Due to the development of technology and computer imaging, the practice of medicine has seen several incredible advances in diagnostic procedures and treatments. From MRIs to detect musculoskeletal ailments, CAT scans to uncover problems in the brain, and cardiac exams to diagnose potentially fatal arterial blocks in the heart, it seems there is no limit to what doctors can diagnose and treat. But advances in medical technology aren't just limited to conventional medical treatments. Chiropractic care is also benefiting from newly developed state-of-the-art diagnostic tools. Representing the most rapidly growing segment of the professional health industry, chiropractic care helps treat more than 20 million Americans each year. Sense Technology Incorporated, a company with more than 20 years' experience in the research and development of chiropractic tools and state-of-the-art equipment, has developed a system that is making a big difference for chiropractors and their patients. The difference is the Polestar Fraz, a revolutionary way for chiropractors to pinpoint exactly where the problem lies in order to correctly diagnose and treat it.
The Polestar is a computerized analysis instrument that allows the doctor to actually do an assessment of the spinal segments of the patient at each visit. With this information, the doctor can then actually use the instrument to adjust those segments that need to be adjusted, and then also put a little bit more motion into the spine as well. The Polestar was given several clearances by the FDA in 1994 and then again in 1998. There is actually peer-reviewed journal research which shows that common musculoskeletal complaints like neck pain, back pain, lower back pain, and leg pain respond very well to Polestar treatment. What we find is that these fixations that are located with the Polestar and then adjusted with the multiple impulse therapy can release that fixation, which often is what's causing those actual common complaints.
Back pain can be caused by a number of reasons, including irritated or damaged nerves, strained muscles, injured bones or ligaments, or damaged spinal discs. But until now, chiropractic professionals only had their expert knowledge and their patient's symptoms to rely on in order to pinpoint the exact location of the problem.
The Polestar Fraz is a handheld device that can be used on a patient by putting a slight impulse into the patient's spine, records the resistance given back to that force, so then it displays a graphical display on the computer. Off of that display, then the clinician can make a diagnosis to find spinal fixations. The Polestar impulse head uses sensors that are built into the head of the instrument that records the resistance given back to the force that it's putting into the patient. When it records this resistance, then it maps out the spine on the computer graphs where the clinician then can find the spinal fixations. The impulse head uses a sophisticated software program that assists the doctor in making a more accurate diagnosis. The data is displayed as a bar graph on the computer so the doctor can easily see where the patient needs to be adjusted.
Each bar graph represents the resistance provided by the patient to the analysis impulse. A low bar represents lower resistance than a high bar. The resistance is determined by the condition of the tissue surrounding the joint, as well as the movement of the joint.
When you look at the computer screen, you see that there are three different graphs. The first graph is the last reading of the patient when they were in prior to the day's visit. So you have an immediate visual impact as to what the patient's graph looked like the last time they were in. The second graph that we see is actually a pre-graph, which means that that's the reading you took on the patient just prior to adjusting the patient. And we use the information we see from that graph along with other information that we have about the patient, their case history, their examination, their x-ray findings, and so on, to determine where we're going to actually adjust the patient. And then the adjustment is given, and the third graph is the one that shows the changes that were made in the spine after the adjustment. And that's where we're looking to find corrections from the stiff areas of the spine.
The force of the Polestar Fraz can be adjusted from a very light 5 pounds of force to a jackhammer-like 35 pounds of force. Doctors only use the lightest force needed to correctly diagnose the problem. The doctor also has complete control of how many thrusts are applied as the instrument is applied against the patient. All the data is stored in the computer, allowing for strict record keeping of each patient's treatment.
The pulse star doesn't hurt the patient at all. It uses a light force that is put against the patient's spine that is controlled by a computer.
A recent study done on the treatment of spinal subluxations by multiple impulse therapy with Pulsar FRAS indicated that 50% of patients treated for neck pain felt a 100% reduction in pain in 4 visits or less. Another study involving patients with one of the most common spinal ailments, lower back pain, found that half of patients treated with multiple impulse therapy, such as the Pulsar FRAS, also experienced a 100% reduction in pain in 4 visits or less.